Great strides have been made in understanding asthma. The medical field now agrees that asthma is a disorder characterized by twitchy airways, known as hyperreactivity, and inflammation in the lungs. There are different types of drugs used to treat these two characteristics of the disease. By focusing on the underlying inflammation, you can better control the symptoms to reduce the occurrence of asthma attacks. Inflammation is a response that normally occurs when your body needs to fight a disease or a disturbance to its natural balance. Asthma, allergies, cold, stress, or exercise can all cause inflammation. Inflammation can also be the result when you breathe in cigarette smoke or have a viral infection. You probably know the feeling of an asthma attack, the tightness in the chest, the feeling that you can't breathe, or perhaps even wheeze when you breathe. But do you know what's actually happening inside your lungs? In people with asthma, the inflammatory response is exaggerated and many different kinds of cells are involved. These cells go through a complex set of activities to release chemicals. The chemicals are what cause the symptoms of an asthma attack. If this happens on a regular basis, your lungs may be damaged. Although you may always have asthma, there are treatments that can minimize and control the occurrence and alleviate the symptoms of an asthma attack. In fact, the inflammatory cells and chemicals in your lungs can be controlled when you use an inhaled corticosteroid, ICS, the most common treatment for asthma. This medication is usually delivered to the cells in your lungs through an inhaler.
Your doctor may recommend a spirometry test to identify a disease in your lungs or check the severity of your existing lung disease. During the test, your caregiver will use a device called a spirometer. A spirometer is a machine that measures exhaled air. Before you take the spirometry test, you will sit in a comfortable chair with your feet flat on the floor. If you have dentures, you may be asked to remove them. For best results, you will be advised to follow your caregiver's instructions exactly. To start, you will raise your head and chin so that you can breathe easily. Next, you may place a clip on your nose to prevent air from coming out of your nostrils. Then, you'll take a deep breath, filling your lungs completely with air, and hold it. You will place the spirometer's mouthpiece between your teeth and tightly seal your lips around it. Finally, you will blast the air out of your lungs as hard and as fast as you can. Your caregiver will tell you when to stop. Adults typically blow for at least 6 seconds. You will need to perform the spirometry test correctly 3 times to get accurate results. Your doctor will discuss the results with you and let you know if you have any breathing problems.